I mean, who doesn't want their smile back? And we can do that for you. We can help with any case. For example, your teeth are being affected because of a genetic disorder. Maybe you were a drug abuser in the past and now you're recovering and you're all clean. Maybe you had a trauma where you lost your teeth. Maybe it's your age. All these scenarios, doesn't matter what it is, we can help. As growing up, I saw my uncle changing a lot of lives through dentistry. That made a big impact on my life, how people would come in pain and leave with a smile on their face. The majority of the patients don't think that they can be helped. They think that there is no solution to their problem, and they let that problem grow to a point where they're suffering every day with pain. It's not just affecting their mouth, it's affecting their overall health. They can't go out, they can't eat, they feel hopeless, and they start living in their own shell. You know, there is a solution to their problem. Nothing is hopeless, especially in today's generation with all the technology that we have. We can make this happen. The world has changed. What was impossible 5 years ago, 10 years ago, it's possible today. So everything can be done same day. When I say same day, what I mean is you come in with your existing teeth, existing problem. Within a couple hours, you walk out with a brand new smile that you are looking for. And we can make that possible here. So there's this procedure that we do. It's called All on 4, where we give you full mouth of teeth. You can eat your favorite food. For example, bite into an apple, corn, steak, go out, socialize, smile, be yourself again. You don't have to hide your smile. It's not just a cosmetic issue. It's a functional issue as well, where I've seen patients that come in, they're not able to eat. It's affecting their overall health. They're malnutrition. They can't eat, they can't chew, so they're swallowing their food, which is affecting their overall health. They're affecting their gastric. They're not getting their nutrition that they should be getting through their food by properly chewing. And we can make that happen within a day. People also suffer emotionally from this because they can't go out. We'll change your life around. We'll make sure you're able to smile, you're able to eat, you're able to live the life that you lived earlier when you had healthy teeth. For example, I had a patient who sat in my chair and would not remove their hand from their mouth because they were so embarrassed of their smile. Started crying in the chair. I asked the patient, hey, how long have you been struggling with this? And they said it's been about 5-7 years. They're not able to go out. They can't eat. They can't smile. We looked at their teeth. We looked at their x-rays and we gave them a solution. And you won't believe it. The day they had their smile back, their life changed. So the whole idea, the whole concept that we do is we take all their bad teeth out, take all the infection out the same day, put the implants in the same day. With the help of technology, we're able to scan everything the same day. The great part is we have in-house lab. So we don't send anything outside. The same day, we're able to print their teeth and fix them into their jawbone. So they walk out with the teeth the same day. And we let that heal for about 3 months. For that 3 months, they get to play with their design. Some patients, they're smiling after such a long time. So they have different expectations, right? I want my smile. I want my teeth to be a little bigger, smaller, wider smile, whatever it could be. And once they're happy with their design, we mill the final. So they get their final in three months. So the whole concept is the second they get their surgery done, after that, they get a new smile from that point. I just want people to give us a chance. Come in for a consultation and we'll see what we can do to help. So what happens over the years is when you're dealing with a lot of issues in the mouth, it takes a big hit on the bone and the tissue. It starts receding over the time. You start losing a lot of bone in your jaw. And that's what makes people think, their case is impossible. But no, it's not. We see these cases every day. And the solution is bone grafting. And with today's technology, the success rate of bone grafting has gone very high. And the best part is we can use that grafting to place our implants so you can have that smile back. We actually had a patient who had her wedding coming up in about 3 to 4 months. She came in for a consult. What she had to deal with was a genetic disorder that was affecting her health. It was affecting her teeth to a point where they were not savable. She was looking at options to get crowns, veneers, but she was getting turned down by many dentists. When she came in for a consult, I looked at her overall bone, I looked at her overall condition, and we suggested, all on X, all on 4. Full mouth reconstruction using implants. We walked her through the process. Her time limit was 3 to 4 months. She was getting her wedding in 3 months, and she wanted this instantly. She just wanted a good smile before she gets married. And once we told her about this treatment, she opted in. This is what she wanted. We were able to get her in within a week, take all the bad teeth out, get rid of all her infection, do some grafting, put the implants in, and she walked out with her smile the same day. And she was ready for her wedding. And funny, she still shares her photos. She shared her pre-shoot wedding photos with us. Sometimes we tell them, hey, bring your favorite food on the day of the delivery for your final. Their husband, wife, their partner will bring in the food. We put the teeth on, like, try them. And the question is, really? You want me to bite into it? Will I be able to bite into it? Tell them, go for it, do it. And the joy they have, on their faces it's amazing. And that's what, gives me happiness.